Welcome, everybody. One thing from the 2020 Gastric Summit, these are some of the numbers that we got here. As you know, there was an impending pandemic, so we had to do a really quick switch and had to add a live stream component because a lot of people couldn't make it. It turned out to be amazing. We had over 4,000 people who attended part of the summit online. And we think that there's going to be as large, if not larger, audience for this one. So be aware to all speakers, you are being live streamed, and it's also being recorded and will be posted on our website in the future. We had 154 people attend live, which was impressive given the impending pandemic. We had anticipated about 300, so it was only about half of what we had anticipated, but 150 was actually the maximum that was allowed at that time by Stanford University. So we're grateful for everyone who attended and made the trip out. So one of the biggest things that we accomplished from this summit was that many of the attendees here helped to write a white paper that Rob Hwang headed that got recently published in the Clinical Journal of Gastroenterology and Hepatology, which is one of the top GI journals in the country. And so we called it a white paper, although they asked us to remove the term white paper because it means something else for the AGA, but technically it is a white paper, and it was an approach to primary and secondary prevention of gastric cancer in the United States. So after publishing this, we actually subsequently submitted recommendations to the USPSTF, and we were just notified a couple weeks ago that they've accepted it for secondary review, and they're going to be voting on it. So we're very, very hopeful that the USPSTF will do a full review of it. Even if it doesn't get accepted, our understanding is if they at least do a full review of this and look at the data, they'll address the gaps in knowledge that need to be addressed, and then that recommendation goes on to Congress and the NIH for future funding. So that would be a big win for us as well. In addition to that, we've been working very diligently on our health policy efforts, and we were fortunate enough with the introduction by Howard Koh to Judy Chu and also Yang-Hee Wu, who was connected to some people in our office. We've had two meetings with Representative Judy Chu, who is the chair of the Congressional Asian Caucus and is also on the Ways and Means for Health. And so she's a very influential person in Congress and has been incredibly supportive. And later on today, I think she's going to be, she has provided us a pre-recorded message. We invited her here, but it's election season, so she wasn't able to attend personally, but she says she's very interested and supportive in these efforts. And then the other really big thing that we did here at the Center for Asian Health Research and Education is we hired Lee Nguyen. Lee, are you in here? Let's bring Lee in. Someone go grab Lee. So Lee, many of you here, we probably got emails from Lee. Lee has been hired by the center as our program manager for public health policy. This is Lee in the back. Say, wave. So she is here to support all of us. And I can say she really has accelerated the progress, very much a go-getter and a doer, and I can't thank her enough for accepting the position here at Stanford with CARE. But if there's anything one thing that I see Lee doing, many of you are from other organizations, we really want to connect with everybody. And so Lee is our connector, and she's already engaged with many of the Asian organizations, Asian health organizations. Hey, Andy, welcome. I think because of Lee, we have a momentum, we have clear direction. We no longer have a bunch of professors not knowing what they're doing, trying to run health policy. So we have a professional that we've hired. So I want to welcome Lee, and she really has coordinated a lot of this. So thank you, Lee. So just to remind everybody why we're here also, this is about gastric cancer, and the perception of gastric cancer in the United States is that it is a very rare disease. Not just rare, very rare. But the argument that I have is it's not that rare. It's similar to esophageal cancer, pancreatic cancer that you hear a lot of in the press, and in part it's who gets it. But who's at risk in the United States for gastric cancer? It's mainly immigrants. It's people from outside of the U.S., big portion from East Asia, which is why we're interested in terms of the Center for Asian Health Research and Education. But it's not just Asia, it's a majority of immigrants in general, so there are large pockets. And so although it might be a relatively small population within the U.S., it's a very high-risk population, and I think that we need to avoid being diluted and make people aware that there's something that we can do about this. And I think these are the statistics that are. I got two computers running here, so I apologize. So this is Lee. On my computer, I was advancing and it wasn't there. So this was our meeting with Representative Chu. This is obviously the slide showing where the high hotspots are for gastric cancer, and they all immigrate here to the U.S. But this is a slide that shows the significance of the disease and how poorly we're doing in the United States. If you look at Korea and Japan, who both have screening programs in place, their ability, or what they've achieved, is they identify disease at an earlier stage. So you see much higher proportion of patients being diagnosed at what we call localized or early stage disease, where it's still curable. In the United States, only about 28% of patients are diagnosed at an early stage, and the 5-year survival is not as good even at that stage. But if you look really at the overall survival, South Korea has an overall survival of 67%, Japan 64%. The United States is a meager 32% of overall survival with gastric cancer. We're doing something wrong. And the most obvious thing that we're not doing is we're not screening high-risk populations. And those high-risk populations, and there will be some fantastic talks at this summit that will make it very crystal clear by the end of the summit on who the high-risk populations are. And what we need to do is make sure we get this information out to the people who can impact change. So here's the big picture goals kind of for the summit and the overall this gastric disparities initiative that we have. Is we want to increase awareness of the increased risk of gastric cancer in high-risk populations, and clearly identify who those high-risk populations are. A lot of these patients who are in high-risk populations don't know, so we need to let the patients know, or those who are affected. We need to let primary care physicians know who they are, so that they can then refer these patients on to gastroenterologists or for further screening. And gastroenterologists don't even know, and even Asian gastroenterologists don't even know. So we really need to do a lot of education. We're making a lot of progress, though. One thing I've noticed at the large meetings is there are more and more talks on gastric cancer. There's much more interest on gastric cancer these days. When I started my career in GI as a GI fellow, I can't remember any talks. I didn't know of this, and it was just my experience with patients in an underserved community at Harborview Medical Center in Seattle that John Intoductory made me do, where I realized what a significant problem this was. We need to establish guidelines. This is low-hanging fruit, and we were just talking about this, that we need to establish gastric cancer screening guidelines in high-risk populations in the United States. And this, we need to engage society. So, I've invited John Intoductory, who's a past president of the AGA, also David Greenwald, who is the past president of the ACG. We have members of the guidelines committees here. We need guidelines, and this is pretty low-hanging fruit because we have good data on this. And then we're trying to engage the American Cancer Society as well. The real big picture is to engage the United States Preventative Services Task Force, which we've done, and we're making progress. And hopefully we'll have good news in the future. And then lastly, but as important are research. And tomorrow we'll focus a lot on what our research goals are. But there are significant gaps in knowledge in gastric cancer. And one of the main criticisms is we don't have any randomized controlled data to show the benefits of screening in high-risk populations. So, we need to do that. We can't just say we don't have the data. Well, we need to have the funding, and we need to be able to do these trials to show that our interventions are beneficial. We need better understanding of H. pylori prevalence and resistance patterns across ethnic and racial groups in the U.S. And what I have here comes straight out from our conference proceedings that we published in Gastro immediately following the 2020 summit. So these were kind of the summary from the 2020 summit. Clinical and biological markers to risk stratify patients with precancerous lesions, such as intestinal metaplasia, for cancer progression across diverse U.S. populations, and we need clinical trials to evaluate potential chemoprevention agents in high-risk individuals. So with that, I want to, can you go back one slide? I want to acknowledge our donors, especially. Without our donors, we would not be here today. So one thing that's really wonderful about being here in Stanford in the Bay Area is that we have very generous donors who see the importance of gatherings like this. So a really big thank you to our donors. To the Center for Asian Health Research and Education, we really do see this as a platform. It was one of the reasons I decided to move down here to Stanford, is that it really gives us some visibility, and I wanted to bring the collective group in the United States and the world together so that we can get together and really raise awareness about this issue. Appreciate the help from the Department of Medicine and the Division of Gastroenterology, and also the participants from the past 2020 summit, which without that being such a big success, this wouldn't have happened. So I look forward to this being a great success. I'm excited to hear all of the presentations.